My name is Walter and I have a respiratory condition, so my GP has prescribed a Genuair inhaler. I'm going to show you how to use a Genuair inhaler correctly. The information I'm going to give you is a quick basic guide, and I recommend that you keep and read the instructions that come with your inhaler. First, I'm going to give you some important points about your inhaler. Then, I'm going to talk you through how to use your inhaler before I show you how to use it. After that, we'll talk about how to clean and store your inhaler, how to know when your inhaler is running out and when to order another one, what to do if you miss a dose or take too much, and what to do if you're going to the clinic or to the hospital. Some inhalers are given to prevent flare-ups, so take them regularly. They will not prevent flare-ups if you only take them when your condition worsens. This is because they can take some days or more to work. The Genuair inhaler is a dry powder inhaler. This means that the drug is in the form of a powder which is inhaled into your lungs. On your inhaler, this button will be green. You will press and release it prior to use. The front has a dosage indicator. This will let me know how many doses I have left. The coloured control window will go green when ready to use and red after use or if empty. The dust cap has two arrows. Squeeze gently and remove the dust cap, revealing the mouthpiece. Check the expiry date on the box. If the date is expired, return to the pharmacist. You should take your inhalers at the same time every day. You can take your inhaler with or without food. Stand or sit upright. Keep your head in a neutral position. Remove the inhaler immediately before use by removing from the pouch by tearing along the notch. Remove the dust cap by gently squeezing the arrows and pulling. Check that there is no dirt or dust on the mouthpiece. Hold the inhaler upright with the green button facing upwards. Press the green button and release it. Check that your indicator is green. Keep your head in a neutral position. Hold the inhaler away from you and breathe out as much as you can, but do not breathe back in yet. Put the mouthpiece in your mouth and seal with your lips. Do not bite on the mouthpiece. Inhale quickly and deeply. You will hear a click, and when you do, continue to breathe in. Once you have inhaled in all the way, remove the inhaler from your mouth and hold your breath for as long as you can for a maximum of 10 seconds, then breathe out slowly. Check that the indicator is now red. If it's still green, you have not inhaled deeply enough. Try again. Replace the dust cap. Brush your teeth and or rinse your mouth out with water or a mouthwash to prevent side effects. Some inhalers can cause voice hoarseness or mouth infections. Wipe your inhaler mouthpiece once a week with a dry tissue. You should keep it somewhere where it will not get moist or wet. It's a good idea to store it somewhere that will help you to remember to take it. The living room or the bedroom are, generally speaking, good places to store it. If you forget to take your inhaler, take it if you remember within an hour or two. If more than that, miss the dose and catch up with your next dose. Do not take your missed dose. If you have taken more doses than you should, you must contact a healthcare professional. The inhaler has a dose counter on the front. It will count down from 60 to 0 in increments of 10. When you see a red stripe band, this means that you are nearing your last dose and should order a replacement. When the last dose has been prepared, you should inhale as normal, but the green button will lock because the inhaler is now empty. Order your inhalers only when you need them, because drugs can expire. It is very important that you take your inhalers and a list of all drugs. Your most recent repeat prescription would be most helpful to all clinics and hospital appointments or admissions.